A mysterious disease that is affecting children and could be related to COVID-19 has a lot of parents very worried. I'm joined by Dr. Lucia Benzoni. She's a pediatrician with Charlotte Hungerford Hospital. Thank you for being with us, doctor.
You're welcome. Glad to be here.
Tell us a little bit more about this mysterious illness. I think parents were first breathing a sigh of relief that kids seem to be okay, and now that may not be the case.
Yeah, I know. I think it wasn't just parents. I think everyone, the whole world was breathing a sigh of relief that children weren't really too involved with the COVID-19. But now we're finding out that children probably had asymptomatic first stage COVID and now are developing a second stage, which is it's basically very similar to a disease that we call Kawasaki disease, which consists of 5 days of high fever, rash, bulbar conjunctivitis, so your eyes get red, but there's no discharge from them. Face can get a rash all over your body. You get hands and feet can be swollen. So that's Kawasaki, and it usually affects children under the age of 5. However, this new one, this pediatric multisystem inflammatory syndrome, PIMS, is affecting children that are older, and the GI symptoms are a little bit more prevalent in that they're getting more abdominal pain, nausea, vomiting with it.
So if you're a parent and you're wondering, some of the other symptoms we know about COVID toe or things like that, you're saying the hallmark, we really need to be concerned if your child has a high fever and the fever doesn't go away?
Yes, so one of the big criteria is fever. We usually say up to 5 days for Kawasaki. I would say now if your child has a fever of unexplained origin, for 3 days you should call your pediatrician.
And do we need to get them tested for anything or just call the doctor?
Call the doctor and let the doctor decide whether or not they need testing.
What about the tests for children? Are children getting tested for COVID or the antibody test, or is it a little different for them?
That's an excellent question, because before very recently, the testing was extremely restricted and most sites were not doing children. The Hartford healthcare system just started doing children under the age of 12, and we are now not asking for all the symptoms like, have you traveled? Have you had a fever? Do you have flu-like symptoms? That's no longer necessary. We can just test you. But that test that you do up the nose is not indicative at all of this inflammatory syndrome. That's a later on development. The children that have the inflammatory symptoms most likely had the active COVID in the nose weeks ago.
Okay. So bottom line for parents, we just want them to keep a lookout, and especially if there's that fever, that's when you really want to call the doctor in, right?
Yes. Fever and belly pain, rapid heart rate. If I always tell my patients, as a parent, you know when something's wrong. Trust your gut. If something's wrong, call your doctor. It doesn't hurt.
Thank you, doctor, for your time. We appreciate it. Thank you.
You're welcome.